Hi, my name is Janice and I'm the nurse here at Pacific Center for Plastic Surgery. Today I will be talking to you about your postoperative instructions following your abdominoplasty, otherwise known as your tummy tuck. I'd like to speak to you first about your activity level. It is very important to begin moving shortly after your surgical procedure. We recommend you walking around for 1 to 2 minutes every hour after your procedure. You can slowly increase your activity level day by day until you are walking at a normal position. When you begin walking, you will be walking in a stooped position so that you do not put excessive strain on your abdominal muscles. After about 1 week, you will begin to start standing in a straight position. We recommend no heavy lifting, exercise, bending, or swimming for the first 6 weeks after your procedure. We also recommend no sexual intercourse, alcohol, or sun exposure for the first 2 weeks following your procedure. Next, I'd like to talk to you about your position. We recommend you sleeping in an elevated position, either on a recliner or using 2 to 3 pillows to elevate your head, neck, and your back. We also ask that you place a couple of pillows underneath your knees to keep them in a bent position to decrease the strain on your abdominal muscles. We do recommend using ice packs for comfort in your postoperative phase. You may use ice packs for 20 minutes on and 20 minutes off while you are awake. Be sure to not place ice packs directly on any incisions. Use them only in the exposed skin areas, but again, do not place them directly on the skin. Put a thin barrier of either a towel or a thin pillowcase between your skin and the ice. You may use the ice for the first 48 to 72 hours after your procedure to help decrease your swelling. Next, we're going to be talking about showering and wound care. It is very important that if you've had drains placed, that you do not shower until after those drains have been removed by your physician. If you did not have drains placed, you may shower 3 days after your procedure. Please leave any tapes on your incisions until they've been removed by your physician. If your tapes happen to fall off, you may begin to clean those areas with the hydrogen peroxide we've provided. Be sure to mix that half and half with water and clean the areas 2 to 3 times a day, letting it dry and then placing a thin layer of the bacitracin ointment on. We recommend you cleaning these sites for the first 7 to 10 days after your procedure or until your incisions are completely healed. Please wear all garments that the physician has placed on you until you see your physician. You may be recommended to wear these garments for up to 6 weeks in your postoperative phase. You will only be removing these garments if you need to shower or if you need to launder them. Remember, it is normal to have some swelling and bruising in your postoperative phase. It is also normal to have some itching and some tightness and redness. However, excessive redness or warmth can be signs of an infection. If you notice a fever of greater than 100 degrees, or if your pain is not relieved by the prescribed medication, please call the office immediately.